Good morning. Appreciate the opportunity. Thank you, Chairman. Thank you all for the opportunity to make a few comments this morning. First and foremost, I appreciate the work you all do to advocate and represent your constituents. And as President and CEO of Reid Health in Richmond, Indiana, we too serve our community and constantly look for ways where we can serve our constituents and our patients better and enrich the lives of our community. First and foremost, I want to thank you all and Dr. Johnson working with the IHA, and I'm here on behalf of the IHA, and really empowering physicians with some of the peer-to-peer language as to put some of that clinical decision-making back in the hands of the physicians. Our physicians are the only individuals who have taken a Hippocratic oath to do no harm by the patient. They have the best interests of patients in mind. There's a tremendous amount of burnout amongst physicians, and on behalf of our provider community, I hear a tremendous amount of comments and frustrations about, one, the challenges around delivering exceptional health care, but yet having to constantly fight with insurance companies around downcoding and underpayment is just a tremendous burden that I don't believe physicians should have to be burdened with, nor our teams when we've delivered life-saving care to patients. Only at the time when it comes to pay for the bill, the insurance companies determine that we weren't or shouldn't receive those dollars. So I appreciate that work. Just to give an example, approximately $25 to $30 million a year is lost to underpayments, no payments, and downcoding from insurance companies. So I want to continue to just advocate for ultimately the work that's being done to make sure that we get paid appropriately for the work we do. I tell our teams we want to be reimbursed nothing more than we deserve, nothing less, just ultimately what we deserve. I will say I do have a few concerns in relationship to some of the reporting on community benefit, and I'm willing and appreciate the work with the IHA and appreciate the comments around willing to work with the IHA and the provider community around community benefit. I have worked and operated hospitals in 4 different states, both for-profit and not-for-profit. And increasingly, there appears to be an increasing focus on not-for-profit status. But I would just encourage you all to continue to work with the provider community. We want to be part of the solution and have some thoughts alongside the IHA as far as what's appropriate. And if there are things that you feel aren't appropriate to be considered within community benefit, we are willing to consider and report accordingly. But some of the additional reporting requirements, as we talk about healthcare becoming increasingly complex, an administrative burden, a lot of that comes from the legislative space, both at the federal and at the state level. There's a lot of regulations, a lot of reporting requirements. That takes time and resources, clearly from our teams. That comes at a cost. We're here to serve our communities well, and ultimately want to focus on solutions to deliver the best clinical care and outcomes for our patients. So in the bill, there's some duplicative things, and I know the committee is going to be working through some of the things that are duplicative, both at the state and federal level. So I appreciate the support and more accountability on holding the insurance companies accountable for services that we've rendered and they determine are on necessary. I'll just give a practical example. We can get a surgery authorized, but the physician that's performing the surgery may determine that for the benefit of the patient, there's an additional or a more expensive or extensive procedure that needs to be done. If that more extensive procedure isn't caught and or authorized at the time of service, then we'll get paid zero. So they won't even pay for the service that's a lesser cost, less of a resource than what we've provided. They won't pay for the lesser one of. And I, at a minimum, would just like to get paid the lesser of. But these are the complexities that we deal in day out. The Medicare Advantage payers are the worst. And what you all have to realize that if that margin leaves the state, chances are it's never going to come back. That is a detriment to Hoosiers, it's a detriment to our communities, and it's a detriment for us to be able to fulfill our mission and enrich the lives of our patients and our communities. So I appreciate the work that's being done and appreciate each and every one of you, and I'm happy to answer any questions you may have.